Researchers continue to look at the long-term impacts of COVID. And with Omicron, they've discovered an interesting connection to what's happening in your brain. And joining us now is Dr. Munir Ghassani to share what was found. I'm fascinated by this research that you've been able to find. Good morning, by the way.
Good morning.
And the links that this possibly could show as to how different variants may impact different parts of our bodies. What did you find?
So what we found was an interesting case of a cancer patient. Patient had a thyroid cancer, and we were doing a scan. We do nuclear medicine scans. This particular one was a PET CT scan. We use a radioactive glucose to guide us to where the cancer could be. And this particular patient's Omicron variant was, for all practical purposes, was mimicking cancer. And that's the image that you see right in the tonsils and around the mouth. It all looked very much like cancer, and you have a little lymph node on the left side. And when we checked further, we found that patient actually was tested positive about 6 days ago. And so we stopped worrying about the cancer, and we just told the clinician that this patient needs to have further workup. Instead of worrying about cancer, we can practically follow and see if that pattern goes away. That's a consistent pattern with Omicron.
So it sounds like in this particular variant, it might be just located more in the upper respiratory area than where you might have seen it before. But it also sounds like this information may be more beneficial than to the medical community to say, hey, maybe you're not diagnosing what it appears to be on the surface.
Correct, yeah. So it's on the surface, and if you are routinely doing the scans like these for cancer patients, you need to be aware that not everything that shows up there could be cancer. This could very well be just an Omicron, and many times the patients don't even have any symptoms, so you need to really test if you find a pattern, and if there is no prior pattern seen on the previous scans, then you really have to worry that this is in fact an Omicron.
So you're able to pick it up on the scans. Are you able to use any of that information to see if this potentially could cause more long-term effects rather than just the short-term that some patients are feeling with the Omicron?
So actually, there are several trials going on, several guided by our Society of Nuclear Medicine and our institutional trials, including my own institution at Mount Sinai in New York, where using several methods, we are looking at the long-term implications of COVID-19. And in fact, we have our annual meeting in June this year, and we have several presentations on the long-term effects.
It's fascinating research that you've been able to find. Now, I assume that you're not going to be using any of these PET scans or CAT scans just as a way to determine if that's there. You're just saying if a doctor does one of these scans, you might see something different.
Correct, yeah. This is not by any means the way of diagnosing Omicron. The Omicron should be diagnosed just like all the other COVID variants by doing the nasal and salivary tests. Only if you're doing the scans for other purpose, which we primarily do it for cancer, but we also do these for brain imaging as well as for heart imaging. So when you do these scans, and if you find this pattern, you don't need to be mindful. And first, you need to see if the patient already had a test done. And if not, and if the patient has any symptoms or prior exposure, then you need to recommend that they should get the test done.
Dr. Munir Ghassani is with Mount Sinai in New York. I appreciate you joining us this morning. It's definitely interesting, and we'll be keeping an eye on it from here on out. Thank you so much.
Thank you.